I want to actually take time to really listen to your lessons learned. So when you started, I'm assuming you were a young, motivated, highly educated doctor, right?
Yeah, I needed the money.
Yeah, you needed the money, right?
There was no money in it.
There was no money in it, but you did it out of a certain idealism, right? And you probably did it under the professional understanding, hey, listen, I'm a trained medical practitioner. I know what I'm doing.
Yeah.
Right?
But that was a mistake.
But that was a mistake.
Yes,
So
that was the first mistake.
Give us examples where for the first time you maybe after a shift said, hey, listen, something about my training is inadequate for the situation I'm in.
Oh my gosh, there are a lot of, for example, that usually people who come to my regular doctor's office or to the hospital, they show their problems, they show everything and more because they want to that you see all of it. And homeless people, they are ashamed of their whole being, actually. And when they come to you, very often they show you one spot that got hurt, for example.
But maybe not the most important thing.
Yeah, but you just look at that spot. And then because you are in a hurry, there are a lot of other guys who needed to be treated. And you just look at the spot and you just put some disinfectant or whatever, bandage over it. And then comes the next one. But you have to look at the whole person, because very often it turns out that there is another spot and another wound and a lot of wounds which are a symbol or which show that they have a general infection which needs antibiotic
So this
treatment.
might just be just the tip of the iceberg.
Yeah. And you just treat this because the person is ashamed to get undressed because they are not that dirty, or I think this shame is very, very big part of the homeless issue.
So you're basically saying, this is also interesting that you're saying that, and this pertains to any form of management out there. There's maybe tools and practices that you use to solve certain problems, but at the end of the day, the most important thing is taking a holistic look at things and involving the human being.
Yeah.
So what you're saying is one of the things you learned, which is much stronger on the street than you in your general practice, is the psychological aspect, the empathy, the understanding, the ability to engage somebody into conversation, which we often don't have time in it. You don't have time for that in a general practice, right?
You don't take this time, actually. So it's like my dog is just lying there, and he had the best life a dog could have. And I used to compare the street medicine with the regular medicine. You have a street dog, and I once tried to catch a street dog in Egypt because I wanted to rescue it. Him, she, he, wherever, whatever, and her. And I could not get close to her because she was so afraid, and she had such a lot of bad experiences and stories in her life. And so I couldn't manage that she took my help. She could accept my help. And this is the same with people who are living on the street, because the experience they usually have is that doctors or paramedics, they come and they help, but it's not, they very often...
They're used to a different pattern.
Yeah.
And the pattern is that they deal with clients that also are in this framework is, I have to be time efficient. I want to state the problem. I don't want the emotions don't play such a big role. Yeah. I think it's really interesting that you mentioned that. You say that actually the biggest factor that plays a role in what you do is the psychological factor.
Yeah, creating trust.
Creating trust. So